So what exactly are the primary care clinics?
Well, you have emergency rooms. You're supposed to go to an emergency room when you have an emergency. And then there's something called a primary care clinic, which are operated by not-for-profit organizations throughout the United States, where you go not for emergency care, but if your kid has the flu or you sprain your ankle or something like that, or you're running a temperature and you need a prescription for an antibiotic. And they are a critical element in healthcare because most people do not have the resources even to interact with the healthcare system. So if I'm a single mother of 3 working 2 jobs, and I pick my kids up from daycare and one of them has a temperature of 104, I don't even bother trying to see a doctor, because if I call a doctor up, he'll say, okay, I understand I can see him at 2:30 tomorrow afternoon, but you got to go to work at 2:30 tomorrow afternoon. So your only real choice is to haul him down to the emergency room where you don't get appropriate or proper care. So the biggest hole in our healthcare system is that for all people, but for poor people in general, there's nowhere to go to get primary health care. And so part of my campaign is I think that every hospital in America, just as it's required to have an emergency room, should be required to have a 24-hour primary health care clinic where you can go in and without having to pay anything, you can be seen by a nurse practitioner or an intern or a doctor who can at least tell you whether you need further care, whether you need to go to an emergency room, because that's where the rubber meets the road. That's what people really need. And while these things exist in America, they are constrained by a multitude of insurance rules, and they are not as available as emergency rooms.
So something, a go-between an evaluation place that each hospital was mandated to have, under what you would say,
Yeah.
that's not an emergency room, or it's not a full-in stay. It's someone that's mainly an evaluation.
In the old days, Dr. Wilby would be your physician, and he would live in your neighborhood. He would have a little office in your neighborhood, and if you came home from work and found your son with 104 temperature, you wouldn't even bother to go make an appointment. You'd just run over to his house, and if it was during office hours, he would fit you in if your kid was sick, and if it wasn't during office hours, he'd get up out of bed or leave his family dinner table, and he'd come out and see the kid, and he would say, he needs an antibiotic, I'll give you a prescription, and you'd go home. That system has completely disappeared, doesn't exist anymore. So if you get home and your kid has 104 temperature, you could call your doctor if you like, but your doctor won't be available. And if he is available, he won't be able to give you an appointment the next morning. And if he can give you an appointment the next morning, you can't go there because you got to go to work.
Right.
You need a place to go right now and get primary interaction with that. And you don't need a genius, because most of these family doctors were not geniuses. You don't need somebody with 14 years of medical school. You just need somebody who is a medical professional who can deal with primary care issues. If you go in and it's clear that you have Ebola, the person can say, go over to the emergency room. But if your kid has a temperature and he's got influenza, you can give him some medication. And that type of facility ought to be available for everybody. It ought to be available without reference to being able to pay.
Okay.
So if you go in there and you have Medicaid or you have Medicare or you have private health insurance, that's fine, charge it. But if you go in there and you say, I'm a Mexican immigrant and I have no health care, they ought to tell you whether your child needs an antibiotic.
Is that different from the urgent care facilities that are in New York City?
Yep.
I think those are a little.
If you go to the urgent care facilities in New York and you don't have insurance and you don't have $150,
yeah,
they're not going to see you.
That is correct. I haven't used those many times.
and the urgent care facilities are great. They are a step in the right direction. But you need facilities for everybody.
You should have some little more robust, that's more equitable Well, and that almost sounds like is that bordering along on socialism there, or is that?
Well, we have a commitment in this country for the government to take care of people's urgent needs. So if you get hit by a bus and go to the hospital, they don't determine whether you can pay for it or not before they put you into ICU. And so and for most people, your child having 104 temperature is an emergency.
It's compelling.